A study led by researchers with the Ontario Medical Association has found no evidence that patients substituted hospital emergency rooms for virtual visits with their family doctor in the first year of the COVID-19 pandemic. The peer-reviewed study was published today in the Canadian Medical Association Journal. Researchers say it is significant given recent calls to reduce virtual service over quality of care concerns and ER burdens. The study says there was no evidence the pivot to virtual visits by family doctors at the outset of the pandemic led patients to turn to emergency departments instead. Well, joining us now to give us more insight into this study is Dr. Zacharias, the president of the Ontario Medical Association. Doctor, welcome to Forum Daily.
Thank you.
So, Dr. Zacharias, let's start with how the study was conducted, along with the particular demographics and information it was looking into.
So the OMA studies approximately 8,000 physicians and has a look at the breakdown of virtual visits. And what we know is that this study shows that the unprecedented strain on the emergency departments, which we all have been aware of, is not associated with patients accessing their family doctors virtually.
All right, ma'am. Now, OMA researchers are saying these findings in the study are quite significant. We're hearing calls to reduce virtual service over concerns of this putting a burden on ERs, as you just addressed right now, and the quality of care overall in the healthcare system. So, can you tell us a little bit more about how these findings address these concerns in particular?
So we know that inside of a patient-doctor relationship, so a family doctor that you have a relationship over a long period of time, or a referral that you received from a family doctor to see a specialist, those are really the comprehensive patient-doctor relationships that we are referring to when we say that a hybrid model of care can be very beneficial to a patient. Easier access, more convenient, following up with lab results or x-ray results or a refill of a prescription or even a healthcare consultation can happen between a doctor and a patient virtually on a screen and really be part of that high quality care that we want to provide for our patients.
Now, all of this is coming amid staffing shortages and burnout among healthcare workers, and a lot of people are lacking a family doctor in Ontario itself. So, how is virtual primary care affecting this situation in particular?
We are very concerned about many people, well over 1 million people in Ontario that don't have a family doctor. The Ontario Medical Association is committed to working with government on solutions there. We talk about licensing internationally trained physicians and have them join the physician workforce and take on the rural, remote, and northern communities. But what we know is that when the pandemic really forced us to pivot to virtual care inside of a family practice, we know that that has not added to the strain that we see in our emergency departments. That strain exists, and for many reasons, which we understand, but the virtual care that has now been adopted by family doctors across the province, the hybrid model, occasionally virtual, occasionally in person, whenever medically appropriate, is not adding to the strain of our emergency departments.
All right, doctor. Now, as you say, the study is looking at primary care physicians with an established patient-doctor relationship, not virtual walk-in appointments. But what do we know so far about the success rate of these virtual walk-in appointments in particular?
So the virtual only clinics are not really captured in the study. There has been some studies that point to a particular finding, and that's that we know that patients who see a family physician at a virtual walk-in clinic are actually twice as likely to visit an emergency department within 30 days compared to those patients seeing their own family doctor virtually. So that's an important distinguishing factor there, that relationship, established relationship between a patient and a doctor seems to be very protective and preserving the ability to provide good quality care and not strain the healthcare system at the same time.
Some distinguishing information there for sure. All right, Dr. Zacharias, it looks like we're out of time, but again, we really appreciate you joining us today and talking to us.
You're welcome.